So herniated discs are a more severe variation of the slipped and bulging discs, and in this video I'm going to talk a little bit more about those. Now, we discussed last time in the bulging disc or slip disc page how the discs are kind of like a water balloon, in so much as if you squash them they bulge out to the side, and this creates problems in the spine, it creates inflammation, it also irritates nerves, giving things like sciatica. Now, herniated discs are where that compression and that bulging is more severe to the point where it causes significant damage to the tissues, or the disc in particular, resulting in what's called a disc herniation. Now, commonly speaking, these are going to affect a few key areas. Number one, they're going to affect these bottom two discs, 4-5 and 5S1 in the lumbar spine. And in the neck, they commonly affect the lower section of the neck to midsection of the neck. And what we find in our experience is they're frequently associated with reductions in the curve, i.e. the natural lordosis is flatter. The spine in the lower back is flatter. And if you're doing any sort of exercises that involve flattening out the spine, you need to cut those out because those are not helping. All they do is serve to press more on the front of the disc, which drives it backwards through those injured structures. So please try and avoid that. And if you want to learn more about that, check it out on our website because we've got tons of videos on not doing that. So that's really, really important. Now, the thing with herniated discs is you're more likely to get those radicular symptoms, or symptoms going down the legs, because it's a more severe disc injury. There's going to be more inflammation, and again we have that small little space where that disc can hit the nerve and send the symptoms down the arms or legs. Now, when it comes to treating these discs, it's the same sort of treatment, but because we've got more tissue damage and you're walking around every day, we've got more barriers to recovery. And often those herniated discs didn't start out as a herniated disc. A patient will come in and say, I put my socks on this morning and I herniated my disc, or that was how it started. And that's not the case. Putting the socks on is not a severe, a challenging enterprise in any way, shape or form. It means that you have significant risk factors. You probably already had a significant degree of disc damage, and that was the sort of the straw that broke the camel's back. I use the analogy in a lot of cases is if you've ever ripped your trousers a little bit, then the second time you bend over, it really rips bad. Well, that's the herniated disc. And there had to be, for such a small thing like picking up a sock or something like that, there had to be a degree of significant damage there anyway before you did that final disc herniation. So essentially, disc herniations often have that backdrop of a problem building up for a long period of time. So the treatment needs to be effective, and we do things like spinal decompression to take pressure off the discs, laser therapy to help them heal more effectively, vibration to work on that muscle spasm that's associated with that, and the spinal adjusting to get the other joints moving as well as possible so that they can take pressure off that injured disc and allow it to heal effectively. But that's how we treat those discs. Now, if you want to learn more about herniated discs, then please read the rest of our what we treat section, and you'll learn a little bit more about how they can affect you and the sorts of prognosis. But generally, it's just a more severe version of a slipped or bulging disc, and it needs the appropriate approach, like what we do at the clinic, to get it healing properly.